Hello there, home care superstars. This is Lucas Carroll with the Business of Senior Care, here today to talk about the great state of Georgia. We've helped a number of clients in Georgia to get their home care license, and there are some nuances in Georgia that are really helpful to be aware of as you get into the process. So the focus for this video is an overview of the non-medical home care license in the state of Georgia and what the major steps are for an agency. From a high level perspective, the license type is a private home care provider, or PHCP. This visual kind of shows what the process looks like. And some nuances to know for Georgia, there is this PHCP license, and then the next step up in terms of expanding the service line would be a home health license. The home health license in Georgia has a certificate of need process. So that's a big obstacle for agencies that want to get started in Georgia. The certificate of need is where, if you're looking to start a home health agency, you would have to provide a convincing argument and documentation to show that there is a need in your local community for a new home health agency, which can be a high burden for folks to get started. But the good news is that there's no certificate of need to get started with a private home care provider license. And as we'll see, you can actually provide nursing services under this license type, which we wouldn't traditionally think of for a non-medical home care license. So something to consider, that you can still do nursing services underneath this license in addition to traditional non-medical home care as you get started. And we'll definitely talk more about that. This visual here is the process for the license. So it starts over here with the application. There are a number of policies and procedures that need to be included with the application. And there are roles for the application: the administrator, an alternate administrator, and an RN. Sometimes the most difficult part of the process is identifying the RN for your agency and having them on board. And that person can be either a 1099 or W-2 employee, but it's really important to identify them for your agency and for the application. And then some additional items would be a background check. So everybody on the application has to be in the GChecks portal. GChecks is Georgia's specific database for background checks, and all owners and everybody on the application has to go into GChecks and go get a fingerprint. RNs should already have their fingerprint and information in the GChecks portal. So likely would have to check, but likely would not have to do an additional fingerprinting session for the RN. And then the submission for the application goes through the Gales portal. The Gales portal has, it's not even a year in service yet, but it has helped to speed up the process for home care agencies to get through licensing. The previous portal was the GAMUS portal, and it was very slow and cumbersome. The Gales portal is a little bit better, and the ability to navigate the application is a little bit better for home care agencies. Some other items here for the types of services. So down here you have 3 service types when you submit the application: companion sitter, personal care, and nursing services. So for a traditional non-medical home care agency, companion sitter and personal care makes sense. That's personal care is kind of listed up here above: bathing, toileting, transferring, dressing, that sort of thing. The nursing services is interesting, that you can choose that, which I always recommend that agencies do. I brought up the Georgia regulation because I think it's really important to see, if we can see. Let's see, move this over here. And zoom in on what's allowed under the PHCP license. So the personal care and companion or sitter tasks are listed here. When it says nursing services, it says provided that such services can only be provided by a person licensed as a registered professional nurse or licensed practical nurse in accordance with applicable professional licensing statutes and associated rules. But it does say that you cannot do physical, speech, occupational therapy, nutrition therapy, social services, home health aid services provided by a home health agency, or a proxy. So an important distinction that you're under this license type, you're not a full-fledged home health agency, but you do and are able to provide nursing services underneath based on the RN scope of practice. So it defaults back to the RN license and what the RN is allowed to do under their scope of practice, which can be really helpful for home care agencies to expand their service line into nursing services without having to go get a full home health license, which would then allow you to do physical, speech, occupational therapy, and things like that. So a really good consideration for agencies to expand their service line to do nursing services, which you traditionally think as medical for an agency. So there are a number of other items like a TB test and a local city business license that need to go along with it. But if you're looking to get assistance to navigate the home care licensing process in Georgia, reach out to us at the Business of Senior Care. We're happy to help you to navigate it. Georgia is one of the more complex states. It can be quite cumbersome to make sure that we get everything in there and that it's done accurately and timely so that you can get your license.